What is it about practice management system data that makes it so great for denominators?
There are a number of reasons that practice management system data, specifically claims data, is great for denominators. Those reasons include it's available, it's highly standardized, and it's got a good perspective, a useful perspective. Practice management systems were the first health information systems to go electronic. They've had a lot of time to mature and to standardize. Medicare long ago drove standardization of the healthcare claims system around the HICFA, that's Healthcare Finance Administration, the HICFA 1500 claim form. It's a reliable and pervasive standard. Nearly all insurance companies use that standard to accept their claims. And that perspective is nearly ideal. There can be a little more to it than this, but the best documentation that a patient doctor relationship exists is its tracks through the billing system and a record of the encounters in the practice. There's no more reliable record of that patient doctor relationship. Included with each claim is the foundational data for all denominators. It identifies the practice and the provider. It identifies the patient, including gender, date of birth, and address. It identifies the insurer. It identifies the diagnoses addressed during that visit, identifies the services provided in that visit. It defines or it describes the location and the date and time of that visit, and sometimes even the duration. It's a solid foundation. If the insurer, including Medicare, is questioning the accuracy of your analytics, that data is accessible to them to test it. Now, it's less useful these days while Medicare is moving to all patients, all payers, because Medicare doesn't have access to all payer data from other insurers. But again, whatever they do to verify your data is most easily done by them through the claims. It's simply a solid foundation. We often need supplemental clinical data to further refine the denominator, but claims gives us a first pass identity and count of denominator eligible patients or visits. We call these denominator candidates. It sometimes requires additional clinical data to complete that denominator eligibility determination and the final denominator count. For instance, we can know from claims that a patient is hypertensive, but we need clinical data to know that they are on a diuretic and should have a periodic potassium determination. With claims data, we build the foundation of your quality reporting system. We identify your patients, their diagnoses, the services you provide, a preliminary count of your eligible instances. Clinical data can decrease the count of eligible instances for any measure, but your true eligible instances will never be larger than the number we identify from your claim.